Hi everyone, I'm Dr. Kibet Ian, and I would want to share with you about a project we're doing in a low resource hospital setting. I think it's a project that will really help lots of babies in that hospital, and I'll explain why. And when I was told about it, I realized it was so simple that every hospital should be doing it. I don't know why you're not doing it, and it's so helpful. So I'll go through what the project entails and how you're going to do it. So the project that I'm talking about is using Bubble CPAP for mostly preterm infants. It can also be used for neonates, and the purpose of Bubble CPAP is mostly used to improve the respiration of these children. Respiratory distress syndrome is the commonest cause of death among preterm babies and even in neonates. So the problem is most of these babies are born with premature lungs, and they struggle to breathe. They commonly get apnea. They may also get respiratory infections, and very many of them, it's the most common cause of death in this age group. The problem is when these children develop respiratory distress, their lungs don't expand very well. In fact, when they are gasping, the ventilation taking place is very minimal. And as you all know, it's the pressure difference between after the expansion of the alveoli, which really helps the gas to move into the lungs and for gaseous exchange to take place. So Bubble CPAP is actually a really good intervention because it provides a positive pressure. It provides a positive pressure for these children who are gasping, and so it improves gaseous exchange considerably in these children. So this thing that I'm doing, it's evidence-based. It's actually been done in Kijabe, and studies that were followed up for over a year showed that there is an improvement in neonatal mortality by up to 22% by just using Bubble CPAP. So I want to give a background of the hospital that I'm helping and why I think it's important to them. So I was in this hospital. It's in a low resource hospital in Western Kenya between March and April. And during my time there, it was actually a volunteer role that I was doing as I was looking for a job. I realized that the hospital did not have CPAP, and we actually got a number of preterm patients. At the time when I was rotating in maternity, I believe we got 2, and I'll share a photo of one up here, and that's a baby that I recently visited at 8 months. She was born at actually it was it's called Samuel. Was born at 33 weeks at the hospital, and it was due to premature rupture of membranes. And I actually saw the struggle that we went through just using the conventional oxygen to help this baby breathe. And because of that, I actually saw this a need for CPAP because it really helps reduce the respiratory effort. Also, there are a few babies that we lost due to respiratory distress, and I think like having a program like something like CPAP can really help these babies to reduce the mortalities. So this project, I learned about it from my colleague. Is a resident in Kijabe, Dr. Millicent. There's a time we were presenting in class, and she actually came up with this project, and she actually taught us. And I just followed her up after the session and asked her more about it, and she linked me to a CEO who has done a higher diploma in pediatric emergency from Kijabe called Frank, and he explained to me how you can actually set up CPAP in a low-income hospital quite effectively with just the conventional things that we'll be doing. So I'll share a photo of the things that you're doing, but basically what you need is just a nasal prongs. Then you'll need this. This is a nest. This is the source that will provide a positive pressure. You also need a few of these tubings. This is just an NG tube which will connect to set it up. This is the strapping I've just bought. we'll use it to demarcate in centimeters. As you all know, in CPAP, the pressure is generated from centimeters of water. So we put it here to delineate the centimeters. I actually wanted to buy nasal prongs for the neonates, but I couldn't find it in town. So we are going to use it, what is in the hospital. I'm just hoping that we'll find them there. I think it's there. And yeah, so I think just from what you're saying, it's pretty simple. You can do so much with just this setup. And I talked to the hospital administrator. She was very supportive and excited about the project. I also talked to the two MOs. The hospital has two MOs, and they are also very supportive of this. So we are going to do it. I'll set up, and after I set up, I'll post the photos here, and we are going to do it by tomorrow. I will take this setup to the hospital, we'll connect it, we'll put the nasal prongs, and after we put the nasal prongs, I think it will be ready for use for any babies who struggle in breathing in the hospital. Just one thing, this thing also has its disadvantages that I think it's important to know. First of all, it needs very good nursing care, and I'm hoping that tomorrow the nurses that I meet in maternity, I'll explain to them why about this project very well. But I know the other nurses will not be around on duty, so I also plan to just print it out on a piece of paper and laminate it about why this thing is important, the studies that have been done in Kijabe, then another sheet of paper on how to set it up and how to use it, so that even after the nurses tomorrow leave, we have reference for other nurses who will come. So some of the things that could happen with nasal prongs ideally is septal injuries, so you have to be real careful with that. Also, the patients might get a gaseous distension due to this, and yeah, we'll be teaching them how to identify these things and how to correct them. But ideally, this is such a good project because it can help so many babies to breathe, and it's a low-cost innovation. I think from these things that I've assembled, they cost less than 500 bob. I know nasal prongs are a bit more expensive, and I couldn't find them, but I know the hospital definitely has it, so we are going just to set it up, and we are connecting it to an oxygen source, which is really important, and the hospital has an oxygen source. They have oxygen cylinders in the NBU, and also in the maternity and in the pediatric ward. So we are going to do this, and we are hoping that it will work, and after 6 months or so, we try to get a report to see if they found it useful. If they have, then we can do it on a larger scale, and hopefully if we can even get support, we can do now the conventional CPAP, because it's actually safer. I think there's a YouTube video just explaining that in as much as this is a very good way of doing CPAP, it still has some disadvantages, and the conventional one is really the gold standard. That because we don't have finances for that, we are looking forward to doing that in the future, and also doing other projects. So thank you guys, and hope that you are challenged to also do this project in other hospitals. It's very feasible, it's very doable, and it's very helpful. And I know most of our low resource hospitals don't have it. Yeah, so I'll try to attach other videos to this video, especially of what we'll be doing there. If I can get a good video of what we'll do after we connect this everything in the hospital, I'll also add it here and share it. And yeah, I know it will be a success, and I'm praying for it. Thank you guys. Okay, so this is the first step. As you can see, I've just used a tape measure to delineate 10 centimeters into, using a roll, 1 centimeter intervals, total of 10 centimeters. So that will delineate the 1 to 10 centimeters of water. Okay, yeah, so we've done it. First step is done. We have the bottle. Okay, so I've placed the NGT, and just like that, we have the source of our pressure on the expiratory limb. As you can see, it's at around 7 centimeters, so it's 7 centimeters of water. The pressure generated will be dependent on how deep you go. From there, in this end, we are just going to connect with the nasal prongs tomorrow, and the circuit the prongs to the baby. It will be pretty simple. We're almost done. Hey guys, yeah, the day is finally here. We've just finished setting up the CPAP, but before I tell you how it went, look what I found. I found a very good book. It's called Why There's No Doctor, and it's a village handbook for village healthcare workers, and I really think it could be a good resource, especially for community health promoters, because it really explains the most common conditions that affect most societies. And I think it has very good basic information which could be really helpful to them. So I think I go through this one, and if I find someone who I think would benefit from it, I could share the resource with them. But basically, so today I've just finished setting up the CPAP. I'm actually so excited because it worked, but I'll tell you exactly what it did. First of all, I started my day by creating a what do I call it? By creating a document which outlines the purpose of the CPAP and the procedure of setting it up and the indications and contraindications. I'll actually share it here so that you'll have a look at it. So this document was designed for the nurses because I didn't get an opportunity to teach all the nurses in the hospital about it. I met around 3 today, working in maternity, NBU, and pediatrics, and I taught them, but I know the others who may come later. So I wanted them to have a reference even as they come. So I started my day by doing that and laminated it so that they can use it. Then I went to hospital. So when I went to hospital, as I explained yesterday, I did not find nasal prongs. So I asked if I could get one from there, and we got one nasal prong. And so the hard part was now connecting the NG tube to the nasal prongs. Now I was a bit challenged there because we had to cut one end of the nasal prong to connect it to the NG tube, and to do that it created some a place where air could leak, and seeing that became a bit of a challenge. So the CPAP was not working initially because of that, but the nurses that I found there, they were really good and they were really supportive, and they were just suggesting different ways that you could improvise to say that hole and make it airtight. And we eventually did it, and we set up the CPAP. I'll link the video to see how it is. So the CPAP actually bubbled, and that's the sign that it's working, and there's no air leak. So the bubbling started at around 3 millimeters of mercury for 2, and we just used 5 centimeters of water on the CPAP, and it was bubbling. There were no air leaks, and the nurses were actually so excited because they told me they've been referring very many patients because of CPAP. So by giving them that, I think it will really help their patients considerably. I gave them a few contraindications for that. I know it's contraindicated and they think the patient may have a pneumothorax. It's also contraindicated in a severe respiratory distress. These are patients you want to refer because the CPAP will probably not be sufficient for them. The other contraindication is if they have serious facial injuries, especially in the nose. They could end up getting a pneumocephalus, so you don't want to pressurize air into these babies. But these things are things that rarely happen in children. So you actually expect the project to really help the hospital. I link a few of the photos of what we did today. Just an nozzle prong so that you can have an idea of what we used. I'll also share a link of how we connected it and how it started bubbling. Just one more thing that I realized that if you place the NS bottle at a certain height, the water flows back into the prongs, and this can actually suffocate the baby. So it's actually best if you put it lower than the baby, and that's what we did in the end. But otherwise, thank you so much. The project has been really successful. Thank you for the hospital management. Thank you for the MOs. Thank you for the nurses. Thank you for the Kijabe team for actually making all this possible. Yeah, so yeah, thank you everyone.